January is Cervical Cancer Awareness Month, and this year Geisinger expects nearly 14,000 cases to be diagnosed.
But because of advances in screening, a cervical cancer diagnosis is not as common as it used to be. Newswatch 16's Nikki Kreis explains in tonight's Healthwatch 16 report.
Healthwatch 16 is sponsored by Geisinger Health System.
Cervical cancer is typically diagnosed in women between the ages of 35 and 44, and it was once one of the most common causes of cancer death in women. But according to doctors at Geisinger, vaccines and advances in screenings have helped bring the numbers down. One of the key players, the Pap smear.
It was used to detect cervical cancer before it's cervical cancer. So we call that dysplasia. Which basically you could call it pre-cancer, essentially.
Dr. Scott Purinton is a gynecologic oncologist at Geisinger. He says early-stage cervical cancer usually has no symptoms, which is why Pap smears are so important. Pap smears are recommended starting at age 21.
Usually it's a microscopic diagnosis when they get a Pap smear, and we detect it well before it's cancer and can intervene.
Cervical cancer is caused by a sexually transmitted infection called HPV. There is a vaccine for HPV that girls can get starting at age 9.
If women are coming in and getting appropriately screened and coming back at the appropriate time, again, the chances of them getting cervical cancer are about as close to 0% as one could get.
Dr. Purinton says treatment is usually surgery, but only if the cancer is found early.
Advanced stage disease we typically treat with a combination of radiation and chemotherapy.
January is Cervical Cancer Awareness Month. Dr. Purinton says if all women would get vaccinated against HPV and get yearly Pap smears, this type of cancer should be nearly non-existent. Nikki Kreis, Newswatch 16.